Well, Baylor Scott and White nurses are speaking out against a mandate that would require them to get vaccinated by October. This while Scott and White's ICUs are full and COVID patients are nearly half the reason why. 6 News reporter Andrew Moore tells us what the nurses had to say. Hey, Andrew.
As this protest shows, there are still many people, even in the medical community, that have doubts about the vaccines. Some people have reported side effects and others worry about the long-term effects. Healthcare leaders still say it's the best option, but nurses say it should not be mandatory.
It's not an anti-vax or pro-vax stance. It is a right to choose what you put in your body.
Scott and White nurses now face being fired if they do not get the vaccine. And for some, that's put them between a rock and a hard place. Vaccines are still available under emergency authorization, and even nurses worry not all the science is out.
A vaccine that, number one, has not been FDA approved, and there has not been enough testing done.
Dozens of nurses and community members gathered outside Scott and White today to send this message to the hospital. Many say they love working with their patients, but also want to do what's best for themselves.
It breaks our heart that we have to say, I don't want it, and you're going to fire me.
But at the same time, healthcare workers and administrators are facing the harsh reality that ICUs are being overrun. Scott and White said earlier this week that they may, at some point, not be able to provide critical care if the flood of COVID patients continues. And both hospitals and health districts say the vaccine is truly their best defense. 6 News also asked the nurses what they believe should be done to improve the situation. I mean, what do we do to prevent the spread of COVID and the spike we're seeing right now?
Hand hygiene is number one. Wash your hands.
And what do we do for other people to prevent them from going to the hospital?
Wash their hands. Take your vitamin C. Drink some water. Get some rest. Have some zinc. Get some sunshine.
Of course, with the highly contagious Delta variant, many health officials do not believe zinc and sunshine are enough. Some people at the protest also suggested using alternative drugs, one called hydroxychloroquine and ivermectin. The FDA has not approved any kind of use for either of those drugs to treat COVID. Jasmine?
Thanks, Andrew. Well, as the coronavirus cases continue to spread, let's look at how Central Texas is handling the surge of Delta cases. McLennan County now has 42.6% of eligible people vaccinated and is reporting over 1,000 active cases. Bell County is slowly increasing. We now have 34.8% of the eligible population fully vaccinated, but have over 2,000 cases.